A request from South Carolina could change Medicaid coverage for thousands of low-income parents in the Palmetto State. The state asking the federal government back in June for a waiver to close a coverage gap. The governor's still waiting to hear back from D.C. as Caroline Jaffa reports.
For years, many South Carolinians have fallen into what's called the coverage gap, which means they make too much to qualify for Medicaid, but not enough to afford insurance on a federal marketplace. A request could change that.
It's a half step in that direction of helping out some people who need help.
In late June, Governor McMaster asked Washington for a Section 1115 waiver, which would let the state change its Medicaid program. Governor McMaster said in a letter, quote, granting South Carolina the authorities necessary to reinstitute this initiative will strengthen the Medicaid program's dual missions of financing health services and improving opportunities for independence, self-reliance, and prosperity for the state's citizens. The waiver says to be eligible, the plan would require a person to work or be enrolled in approved education for at least 80 hours a month.
People have a very hard time predicting exactly how many hours they're working, having those hours actually show up, and then recording them correctly. Because one of the things we have to remember, low-wage work is sometimes very unpredictable.
Sue Berkowitz with South Carolina Appleseed Legal Justice Center says that requirement could do more harm than good. She says she has lots of questions for the governor.
I would ask him to spend a day or two with impacted people and see what barriers are in front of them before you put these barriers up.
Anderson says South Carolinians who can qualify and maintain eligibility are much better off.
We know from the Oregon Medicaid experiment that health insurance coverage immediately produces substantial mental health gains. It produces substantial financial protection.
The waiver was filed in late June, and the federal government is now reviewing it. Experts say a decision could take several more months. In Columbia, I'm Caroline Jaffa.